What is back pain? Back pain is a common condition characterized by discomfort or distress in any area of the back, often resulting from strain or tension in the muscles or ligaments. Typical causes of back pain include poor posture, lifting heavy objects improperly, aging, and conditions like arthritis, osteoporosis, and herniated discs. Symptoms can include muscle ache, stabbing or shooting pain, limited flexibility or range of motion, and an inability to stand upright without discomfort. Diagnosis typically involves a physical exam, patient history, and, if necessary, imaging tests like X-rays, CT scans, or MRIs to identify underlying conditions. Conservative treatments include physical therapy, over-the-counter pain relievers, hot or cold therapy, maintaining a healthy weight, and practicing good posture. Interventional treatments can include nerve blocks, steroid injections, radiofrequency ablation, spinal cord stimulation, and, in severe cases, surgery. The goal is to reduce or eliminate pain, improve function and mobility, and prevent future back problems or injuries. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are compression fractures of the spine? A compression fracture occurs when one or more of your vertebrae collapse, often due to the loss of bone density or injury. These fractures are typically caused by osteoporosis, trauma from a fall or accident, or in rare cases, a tumor. Symptoms can include sudden, severe back pain, worsening pain when standing or walking, and a decrease in height. The diagnosis process usually involves a physical exam, patient history, and imaging tests such as X-rays, CT scans, or MRIs. Conservative treatments may include pain medications, back braces, rest, and physical therapy. Interventional treatments can include procedures like vertebroplasty or kyphoplasty, which stabilize the fracture and help reduce pain. The goal is to alleviate pain, stabilize the fracture, restore vertebral height, and prevent further fractures. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are headaches and migraines? Headaches are a common discomfort in the head, while migraines are a type of headache characterized by severe, throbbing pain, typically on one side. Causes can include stress, lack of sleep, dehydration, certain foods or drinks, hormonal changes, and sensory stimuli, like bright lights. Symptoms can include moderate to severe pain, nausea, sensitivity to light or sound, and in migraines, temporary visual disturbances known as aura. Diagnosis typically involves a physical examination, a detailed patient history, and often imaging tests, especially if other conditions are suspected. Conservative treatment options can include over-the-counter pain relievers, rest, hydration, avoiding known triggers, and stress management techniques. Interventional treatments can include prescription medications, nerve blocks, Botox injections, and neuromodulation devices. The goal is to reduce pain, prevent future headaches or migraines, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is a herniated disc? A herniated disc occurs when the soft interior of a spinal disc pushes through a crack in its tough exterior, often causing nerve irritation. This condition is typically caused by age-related wear and tear, improper lifting, excessive body weight, or repetitive strenuous activities. Symptoms can include localized back or neck pain, radiating pain in arms or legs, and numbness or tingling in the area served by affected nerves. Diagnosis usually involves a physical examination, patient history, and imaging tests such as MRI or CT scans. Conservative treatments include pain medications, physical therapy, and lifestyle modifications such as weight management and correct lifting techniques. Interventional treatments can include epidural steroid injections, nerve root injections, discectomy, or in severe cases, surgery. The goal is to relieve pain, improve physical function, and enhance the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is arthritis pain? Arthritis pain is discomfort experienced due to inflammation and damage within joints, commonly associated with different types of arthritis. Arthritis pain is typically caused by wear and tear over time, immune system dysfunction, infections, or a combination of these factors. Symptoms can include joint pain, stiffness, swelling, redness, and decreased range of motion in the affected joints. Diagnosis often involves a physical examination, patient history, blood tests, and imaging, such as X-rays or MRI. Conservative treatments include over-the-counter pain relievers, anti-inflammatory medications, physical therapy, and lifestyle changes like exercise and weight management. Interventional options can include corticosteroid injections, platelet-rich plasma injections, or, in severe cases, joint replacement surgery. The goal is to reduce pain, minimize joint damage, improve mobility, and enhance the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is cancer pain? Cancer pain can result from the cancer itself, such as a tumor pressing on nerves, or from cancer treatments, like chemotherapy or surgery. Common causes of this pain include the cancer's growth affecting bones, nerves, or organs, or side effects from cancer treatments. Symptoms can include aching, throbbing, or burning pain, which can be constant or intermittent and can range in severity. Diagnosis involves a detailed patient history, physical examination, and often imaging tests or laboratory examinations. Conservative treatments primarily include pain relievers ranging from over-the-counter analgesics to prescription opioids, as well as complementary therapies like massage or acupuncture. Interventional treatments can include nerve blocks, neurostimulation, intrathecal drug delivery systems, or radiofrequency ablation. The goal is to manage pain effectively, improve the patient's comfort level, and enhance quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is complex regional pain syndrome? Complex regional pain syndrome, also known as CRPS, is a chronic pain condition most often affecting one limb, usually after an injury, surgery, stroke, or heart attack. CRPS typically occurs after a trauma, surgery, or nervous system damage, but the exact cause is not well understood. Symptoms include prolonged severe pain, swelling, changes in skin color, temperature, and texture, and impaired motor function in the affected area. Diagnosis involves a physical examination, patient history, and might include imaging tests, nerve conduction studies, or sympathetic nervous system tests. Conservative treatments can include physical therapy, psychotherapy, medication for pain and inflammation, and nerve block medications. Interventional treatments can involve nerve blocks, spinal cord stimulation, peripheral nerve stimulation, or intrathecal drug pumps. The goal is to reduce pain, improve function, and maintain quality of life by managing symptoms. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is degenerative disc disease? Degenerative disc disease is a condition where the spinal discs wear down over time, causing pain and potential mobility issues. Common causes include natural aging, wear and tear, injury, and genetic predisposition. Symptoms can include chronic low back or neck pain, intermittent severe pain, numbness, tingling, and weakness. Diagnosis usually involves a physical examination, patient history, and imaging tests such as X-rays or MRIs. Conservative treatments include physical therapy, non-steroidal anti-inflammatory drugs, and lifestyle modifications like exercise and good posture. Interventional treatments can include epidural steroid injections, nerve root injections, spinal cord stimulation, or, in severe cases, surgery. The goal is to manage pain, improve mobility, and enhance the patient's overall quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is interventional pain management? Interventional pain management is a medical subspecialty which uses minimally invasive procedures to diagnose and treat persistent pain conditions. Common reasons to visit an interventional pain management specialist include chronic back pain, arthritis pain, cancer pain, migraines, and pain from nerve damage or injuries. Symptoms requiring this approach often include chronic or severe pain, pain that is not responding to conservative treatments, and decreased quality of life due to pain. Diagnosis involves a comprehensive pain assessment, patient history, physical examination, and often imaging tests or diagnostic procedures. Before resorting to interventional techniques, conservative treatments like medication, physical therapy, and lifestyle modifications are usually tried first. Interventional techniques can include nerve blocks, epidural steroid injections, radiofrequency ablation, spinal cord stimulation, and intrathecal pump implantation. The goal is to significantly reduce or eliminate pain, improve the patient's ability to function, and enhance their quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is joint pain? Joint pain refers to discomfort, aches, and soreness in any of the body's joints, often resulting from an illness or injury. Common causes include arthritis, injuries, inflammatory diseases, cancer, or wear and tear due to age or overuse. Symptoms requiring management include persistent or severe joint pain, swelling, warmth, tenderness, or reduced range of motion. Diagnosis involves a physical examination, patient history, and potentially imaging tests like X-rays or blood tests. Conservative treatments include rest, ice, compression, elevation, pain relief medications, and physical therapy. Interventional treatments can include steroid injections, platelet-rich plasma injections, nerve blocks, or radiofrequency ablation. The goal is to relieve pain, reduce inflammation, improve joint function, and enhance the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is knee pain? Knee pain refers to any discomfort or ache in or around the knee joint, ranging from mild to severe. Common causes include injuries, arthritis, cartilage damage, a dislocated kneecap, or ligament tears. Symptoms requiring management include persistent or severe knee pain, swelling, stiffness, instability, or inability to fully straighten the knee. Diagnosis involves a physical examination, patient history, and potentially imaging tests like X-rays or MRI. Conservative treatments include rest, ice, compression, elevation, pain relief medications, and physical therapy. Interventional treatments can include steroid injections, nerve blocks, radiofrequency ablation, and peripheral nerve stimulation. The goal is to alleviate pain, reduce inflammation, restore function, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is lumbar radiculopathy? Lumbar radiculopathy is a condition where nerve roots in the lower spine are compressed or irritated, leading to pain, numbness, or weakness. Common causes of lumbar radiculopathy include disc herniation, bone spurs, spinal stenosis, or degenerative disc disease. Symptoms requiring management include low back pain, sciatica, numbness, weakness, or loss of motor function in the legs. Diagnosis involves a physical examination, patient history, and potentially imaging tests like MRI or CT scans. Conservative treatments include rest, physical therapy, non-steroidal anti-inflammatory drugs, and epidural steroid injections. Interventional treatments can include nerve root blocks, spinal cord stimulation, or minimally invasive spinal fusion techniques. The goal is to alleviate pain, restore function, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is neck pain? Neck pain is discomfort in any of the structures in the neck, which can range from mild to severe. Common causes include poor posture, overuse, neck strain, osteoarthritis, or injuries such as whiplash. Symptoms requiring management include persistent or severe neck pain, stiffness, headaches, or difficulty moving the head. Diagnosis involves a physical examination, patient history, and potentially imaging tests like X-rays or MRI. Conservative treatments include rest, physical therapy, over-the-counter pain relievers, and maintaining good posture. Interventional treatments can include nerve blocks, epidural steroid injections, or in some cases, surgery. The goal is to reduce pain, restore function, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is pelvic pain? Pelvic pain is discomfort that occurs in the lowest part of the torso, which is the area below the abdomen and between the hip bones. Common causes include pelvic inflammatory disease, ovarian cysts, fibroids, endometriosis, or urinary tract or digestive system disorders. Symptoms requiring management include persistent or severe pelvic pain, discomfort during intercourse, painful urination or irregular bleeding. Diagnosis involves a physical examination, patient history, and potentially imaging tests like ultrasound or MRI scans. Conservative treatments include pain relievers, hormonal treatments, antibiotics if infection is the cause, and physical therapy. Interventional treatments can include nerve blocks, trigger point injections, or in some cases, surgery. The goal is to reduce or eliminate pain, address the underlying cause, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is peripheral neuropathy? Peripheral neuropathy is a disorder that occurs when nerves that carry messages to and from the brain and spinal cord to the rest of your body become damaged or diseased. Common causes include diabetes, infections, genetic disorders, trauma, and nutritional or metabolic problems. Symptoms requiring management include numbness, tingling, pain, muscle weakness, or loss of coordination. Diagnosis involves a physical exam, neurological tests, blood tests, and potentially nerve function tests or nerve biopsy. Conservative treatments include pain relievers, anti-seizure medications, capsaicin cream, physical therapy, and transcutaneous electrical nerve stimulation. Interventional treatments can include nerve blocks, spinal cord stimulation, or, in severe cases, surgery. The goal is to manage symptoms, control pain, and treat any underlying conditions to improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is post-laminectomy syndrome? Post-laminectomy syndrome is persistent pain following back surgery, also known as failed back surgery syndrome. The most common causes include recurrent disc herniation, persistent post-operative pressure on a spinal nerve, altered joint mobility, or scar tissue. Symptoms requiring management include chronic pain, spinal instability, muscle weakness, or mobility issues. Diagnosis involves a physical examination, patient history, and possibly imaging tests like X-ray, CT scan, or MRI. Conservative treatments include physical therapy, non-steroidal anti-inflammatory medications, nerve pain medications, and epidural steroid injections. Interventional treatments can include nerve blocks, spinal cord stimulation, or, in some cases, additional corrective surgery. The goal is to manage pain, improve mobility, and enhance the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is sacroiliac joint pain? Sacroiliac joint pain is discomfort in one or both of the joints that connect the lower spine and pelvis. Common causes include arthritis, pregnancy, trauma, infection, or conditions that alter normal walking pattern. Symptoms requiring management include lower back pain, buttock pain, sciatica-like pain, or difficulty turning or standing from a seated position. Diagnosis involves a physical examination, patient history, and possibly imaging tests or diagnostic injections. Conservative treatments include physical therapy, pain relievers, lifestyle modifications, and sacroiliac joint injections. Interventional treatments can include nerve blocks, radiofrequency ablation, and sacroiliac joint fusion. The goal is to alleviate pain, restore function, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is sciatica? Sciatica is pain that radiates along the path of the sciatic nerve, which branches from your lower back through your hips and buttocks and down one or both legs. Common causes include a herniated disc, bone spur on the spine, or narrowing of the spine, known as spinal stenosis. Symptoms requiring management include lower back pain, hip pain, burning or tingling down the leg, and difficulty moving the leg or foot. Diagnosis involves a physical examination, patient history, and potentially imaging tests like X-ray, MRI, or CT scan. Conservative treatments include physical therapy, over-the-counter pain relievers, and exercises to improve posture and flexibility. Interventional treatments can include epidural steroid injections, nerve blocks, or, in severe cases, minimally invasive spinal fusion procedures. The goal is to alleviate pain, improve mobility, and prevent future sciatica episodes. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is spinal stenosis? Spinal stenosis is a narrowing of the spaces within your spine, which can put pressure on the nerves that travel through the spine. Common causes include aging, osteoarthritis, rheumatoid arthritis, and spinal injuries. Symptoms requiring management include back pain, numbness, or weakness in the legs or torso, and difficulty with balance. Diagnosis involves a physical examination, patient history, and potentially imaging tests like X-ray, MRI, or CT scan. Conservative treatments include physical therapy, pain relievers, anti-inflammatory drugs, and lifestyle adjustments. Interventional treatments can include epidural injections, nerve blocks, minimally invasive decompression procedures, or spinal fusion. The goal is to manage pain, maintain mobility, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is spondylolisthesis? Spondylolisthesis is a spinal condition where one vertebra slips forward over the one below it. Common causes include congenital defect, trauma, and degenerative diseases like arthritis. It can also result from overuse of the lumbar spine. Symptoms requiring management include lower back pain, stiffness, muscle tightness, and nerve pain or numbness radiating to the legs. Diagnosis involves a physical examination, patient history, and imaging tests like X-ray or MRI. Conservative treatments include physical therapy, over-the-counter pain relievers, and exercises to strengthen the abdomen and improve flexibility. Interventional treatments can include epidural steroid injections, nerve blocks, or, in severe cases, minimally invasive spinal fusion procedures. The goal is to alleviate pain, improve function, and prevent further slippage. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is trigeminal neuralgia? Trigeminal neuralgia is a chronic pain condition affecting the trigeminal nerve in the face. Common causes include blood vessels pressing on the trigeminal nerve, multiple sclerosis, or a tumor. Symptoms requiring management include severe facial pain, spasms, and pain while chewing or brushing your teeth. Diagnosis involves a physical examination, patient history, neurological examination, and potentially MRI scans. Conservative treatments include anticonvulsant medications, antidepressants, and over-the-counter pain relievers. Interventional treatments can include nerve blocks, radiofrequency ablation, or surgery on the affected nerve. The goal is to manage pain, restore normal function, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is diabetic neuropathic pain? Diabetic neuropathic pain is a type of nerve damage caused by diabetes, leading to painful sensations. The primary cause is high blood sugar levels in people with diabetes, which damages nerves over time. Symptoms requiring management include numbness, tingling, or burning sensations, especially in hands and feet. Diagnosis involves a physical examination, patient history, blood tests, and possibly nerve function tests. Conservative treatments include blood sugar management, over-the-counter pain relievers, anti-seizure medications, and antidepressants. Interventional treatments can include nerve blocks, transcutaneous electrical nerve stimulation, and spinal cord stimulation. The goal is to manage pain, maintain nerve function, and prevent further nerve damage. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is myofascial pain syndrome? Myofascial pain syndrome is a chronic pain disorder where pressure on sensitive points in your muscles causes pain across different parts of your body. The syndrome often results from muscle injury or excessive strain on a particular muscle or muscle group, particularly ligaments and tendons. Symptoms needing management include deep, aching muscle pain that is persistent, tender knots, and sleep disturbances due to pain. Diagnosis involves a physical examination, patient history, and identifying and evaluating problematic trigger points. Conservative treatments include physical therapy, exercise, heat therapy, and non-prescription pain relievers. Interventional treatments can include trigger point injections, massage therapy, or dry needling. The goal is to alleviate pain, release muscle tension, and restore muscle function. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is occipital neuralgia? Occipital neuralgia is a distinct type of headache characterized by sharp, jabbing pain in the upper neck or back of the head, usually on one side. Common causes include tension in neck muscles, injuries to the neck, or inflammation and irritation of the occipital nerves. Symptoms needing management include sharp, throbbing pain at the base of the head and behind the eyes, and sensitivity to light. Diagnosis involves a physical examination, patient history, and possibly nerve block injections to confirm the source of the pain. Conservative treatments include rest, heat, massage, physical therapy, and over-the-counter anti-inflammatory medication. Interventional treatments can include nerve blocks, steroid injections, or in some cases, surgery. The goal is to alleviate pain, ease muscle tension, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is postherpetic neuralgia? Postherpetic neuralgia is a complication of shingles, which is characterized by severe pain in areas where the shingles rash occurred. The primary cause is damage to nerve fibers during a shingles outbreak, leading to prolonged nerve pain. Symptoms needing management include severe, lingering pain in shingles-affected areas, sensitivity to touch, and itching or numbness. Diagnosis involves a physical examination, review of the patient's history of shingles, and evaluation of symptoms. Conservative treatments include topical creams, antidepressants, anticonvulsants, and opioid medication. Interventional treatments can include nerve blocks, electrical nerve stimulation, and intrathecal pain pumps. The goal is to manage pain, reduce nerve sensitivity, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is fibromyalgia? Fibromyalgia is a chronic condition characterized by widespread musculoskeletal pain, fatigue, and tenderness in localized areas. While the exact cause is unknown, factors may include genetics, infections, physical or emotional trauma, and certain diseases. Symptoms requiring management include chronic muscle pain, fatigue, sleep disturbances, and tender points in the body. Diagnosis involves a physical examination, patient history, and ruling out other conditions with similar symptoms. Conservative treatments include over-the-counter pain relievers, antidepressants, anti-seizure drugs, and physical therapy. Interventional treatments can include acupuncture, massage therapy, yoga, and cognitive behavioral therapies. The goal is to manage pain, improve sleep, and reduce fatigue, thereby improving the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is vertebrogenic pain? Vertebrogenic pain is discomfort originating from the spine's structures, such as the vertebral bodies, intervertebral discs, or facet joints. Common causes include spinal degeneration, herniated discs, spinal stenosis, facet joint dysfunction, and spondylolisthesis. Symptoms requiring management include localized lower back pain, sciatica symptoms, stiffness, and limited mobility. Diagnosis involves a physical examination, patient history, and imaging studies like X-rays, MRI, or CT scans. Conservative treatments include physical therapy, non-steroidal anti-inflammatory drugs, and lifestyle modifications. Interventional treatments can include epidural steroid injections, nerve blocks, basivertebral nerve ablation, or in severe cases, minimally invasive spinal fusion surgery. The goal is to manage pain, restore mobility, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is facet joint dysfunction? Facet joint dysfunction is a condition where the joints in your spine become painful due to arthritis, injury, or repeated stress due to overuse. The most common causes are age-related wear and tear, spinal injury, or excessive stress on the joints from poor posture. Symptoms can include localized pain, stiffness, and difficulty twisting or bending the spine. Diagnosis usually involves a physical examination, patient history, and imaging tests such as X-rays, CT scans, or MRIs. Conservative treatments include physical therapy, pain relievers, muscle relaxants, and lifestyle modifications like exercise and good posture. Interventional treatments can include facet joint injections, medial branch blocks, or radiofrequency ablation. The goal is to manage pain, improve mobility, and enhance the patient's overall quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are Botox injections for chronic migraines? Botox injections for chronic migraines involve injecting Botox, a neurotoxin, into specific areas to prevent migraine headaches. The treatment involves multiple injections around the head and neck every 12 weeks to dull future headache symptoms. Botox injections are used to treat chronic migraines, typically defined as headaches occurring on 15 or more days per month. Benefits include significant reduction in headache frequency, severity, and associated symptoms like nausea and sensitivity to light or sound. Risks of the procedure include neck pain, temporary muscle weakness in the neck and shoulders, and, in rare cases, difficulty swallowing. The recovery time after these injections is minimal, with most patients resuming normal activities immediately after the procedure. The goal is to reduce the frequency and severity of migraines, thereby improving the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are nerve blocks? A nerve block is an injection of anesthetic medication near specific nerves to manage various forms of pain. This procedure involves injecting medication around the affected nerves, often guided by imaging techniques like fluoroscopy or ultrasound. Nerve blocks are used to manage various types of pain, including back pain, neck pain, sciatica, migraines, and complex regional pain syndrome. Benefits include rapid pain relief, decreased inflammation, potential diagnostic benefits, and avoidance of surgery in some instances. Risks can include infection, bleeding, nerve damage, allergic reactions to the anesthetic, or temporary increase in pain. Recovery time varies, but typically most patients can resume regular activities within 24 hours. The goal is to provide pain relief, improve function, and enhance the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are sacroiliac joint injections? Sacroiliac joint injections is a procedure that delivers medication directly into the sacroiliac joints, which are located at the base of the spine. This treatment involves injecting a local anesthetic and a corticosteroid into the sacroiliac joint, often guided by fluoroscopy or CT imaging. Sacroiliac joint injections are used to treat pain originating from the sacroiliac joint, such as sacroiliitis or sacroiliac joint dysfunction. Benefits include rapid pain relief, reduced inflammation, and the ability to confirm the source of the pain. Risks can include infection, bleeding, allergic reactions to the medication, or temporary increase in pain. Most patients can resume their normal activities within 24 hours following the procedure. The goal is to provide immediate pain relief, confirm the pain source, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is a medial branch block? A medial branch block is an injection of local anesthetic near the medial branch nerves, which connect the facet joints in the spine. This procedure involves injecting anesthetic medication onto the medial branch nerves, typically using fluoroscopic guidance for accuracy. Medial branch blocks can diagnose and treat facet joint pain in the neck, mid-back, or lower portion of the spine. Benefits include immediate pain relief, diagnostic value, and it can be a precursor to a longer-lasting procedure called radiofrequency ablation. Risks can include infection, bleeding, allergic reactions, nerve damage, or a temporary increase in pain. Patients typically can resume normal activities immediately after the procedure. The goal is to provide immediate pain relief, accurately diagnose facet joint pain, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is an epidural steroid injection? An epidural steroid injection is a minimally invasive procedure that delivers steroids directly into the epidural space in the spine. The procedure involves injecting a corticosteroid and a local anesthetic into the epidural space surrounding the spinal cord, often guided by fluoroscopy. These injections are used to treat various forms of radicular pain, including sciatica, herniated discs, and spinal stenosis. Benefits include rapid pain relief, reduced inflammation, and potentially delaying or avoiding the need for surgery. Risks can include infection, bleeding, dural puncture, allergic reactions, or a temporary increase in pain. Most patients can resume normal activities within 24 hours after the procedure. The goal is to provide pain relief, improve function, and enhance the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is dorsal root ganglion stimulation therapy? Dorsal root ganglion stimulation therapy involves implanting a stimulation device to deliver electrical signals to the dorsal root ganglion in the spine. The procedure involves surgically implanting electrodes connected to a battery, which send electrical signals to the targeted dorsal root ganglion responsible for your pain. DRG therapy is used to treat chronic pain conditions like complex regional pain syndrome, peripheral neuropathy, and other neuropathic pain conditions. Benefits include significant pain reduction, improved quality of life, and reduced reliance on pain medication. Risks can include infection, bleeding, allergic reaction, device malfunction, or increased pain. Recovery time varies, but most patients can resume normal activities within 2 to 4 weeks post-procedure. The goal is to provide long-term pain relief, reduce medication use, and improve the patient's overall quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is intrathecal pump therapy? Intrathecal pump therapy involves implanting a device that delivers pain medication directly into the spinal fluid. The procedure involves surgically implanting a programmable pump and catheter to deliver medication into the intrathecal space. This therapy treats severe chronic pain and spasticity that have not responded to other treatments. Benefits include targeted pain relief, lower doses of medication, fewer side effects, and improved quality of life. Risks can include infection, bleeding, allergic reaction, device malfunction, or spinal fluid leak. Recovery time varies, but most patients can resume normal activities within 2 to 6 weeks post-procedure. The goal is to manage pain effectively, reduce side effects of high-dosage oral medications, and improve the patient's overall quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is medication management? Medication management is the process of monitoring, optimizing, and ensuring the safe use of medications for treating a patient's health condition. It involves assessing a patient's medications, determining effectiveness, checking for interactions, and adjusting dosage as needed. Medication management can address a range of conditions like chronic pain, hypertension, diabetes, and depression. Benefits include improved medication adherence, minimized side effects, avoiding drug interactions, and better health outcomes. Miscommunication or misunderstanding can lead to medication errors, adverse reactions, or uncontrolled symptoms. It is important to understand that medication management is a continuous process of collaboration to ensure optimal dosing. The goal is to ensure optimal therapeutic outcomes and improve the overall health and quality of life of the patient. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is minimally invasive spinal fusion? Minimally invasive spinal fusion is a surgical procedure to join two or more vertebrae together, which reduces excess motion and relieves pain. The procedure involves making small incisions to access the spine, then fusing the vertebrae using bone grafts, screws, or spacers. It's used for treating conditions like disc degeneration, spinal stenosis, spondylolisthesis, or spinal instability. Benefits include less tissue damage, lower risk of infection, less blood loss, reduced pain, and faster recovery when compared to open spinal fusion surgery. Risks can include infection, nerve damage, blood clots, implant rejection, or non-union of fused bones. Recovery varies, but many patients can return to normal activities within 4 to 6 weeks. The goal is to stabilize the spine, alleviate pain, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is peripheral nerve stimulation? Peripheral nerve stimulation is a therapy in which a device sends electrical impulses to specific nerves to help manage chronic pain. This procedure involves surgically implanting small electrodes near the affected peripheral nerves and connecting those electrodes to an external power source. It is used to treat chronic pain conditions, such as migraines, nerve damage pain, or complex regional pain syndrome. Benefits include significant reduction in pain, less reliance on medication, and improved overall quality of life. Risks can include infection, bleeding, device malfunction, or increased pain. Recovery time varies, but most patients can resume normal activities within 1 to 2 weeks post-procedure. The goal is to provide long-term pain relief, reduce medication use, and improve the patient's overall quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is physical therapy? Physical therapy is a treatment method involving exercises and manual therapy techniques to improve mobility and function. Physical therapy is performed by licensed therapists and includes patient-specific exercises, manual techniques, and education. It is used to treat a variety of conditions, including injuries, chronic pain, neurological conditions, and post-surgical recovery. Benefits include improved mobility, reduced pain, disability prevention, and enhanced physical performance. Risks can include temporary discomfort, fatigue, or the potential for minor injuries due to physical exertion. Therapy plans are based on the individual and the condition, but typically include a few weeks to several months of therapy visits. The goal is to restore or improve functionality, relieve pain, and increase mobility for better quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is radiofrequency ablation? Radiofrequency ablation, also called RFA, is a procedure that uses radio waves to generate heat, and destroy specific nerve tissue, reducing pain signals. A thin, insulated needle is guided to the target nerve. Then, heat generated by electrical current disables the nerve. RFA is used for treating chronic lower back pain, neck pain, arthritic joints, and some types of nerve pain. Benefits include significant reduction in chronic pain, improved function, and less reliance on pain medication. Risks can include infection, bleeding, nerve damage, adverse reaction to anesthesia, or increased pain. Typically, patients can return to their normal activities within several days post-procedure. The goal is to provide long-term pain relief, reduce medication use, and improve the patient's overall functionality and quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is sacroiliac joint fusion? Sacroiliac joint fusion is a surgical procedure to stabilize the joint between the spine and the pelvis, relieving pain. The procedure involves fusing the sacroiliac joint by inserting small implants across the joint. SI joint fusion is used to treat chronic pain associated with sacroiliac joint dysfunction or inflammation. The benefits include decreased pain, improved function and mobility, and increased quality of life. Risks can include infection, bleeding, nerve damage, or failed fusion of the sacroiliac joint. Recovery time varies, but patients generally return to normal activities within 4 to 6 weeks. The goal is to stabilize the joint, alleviate pain, and improve the patient's daily function and quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is spinal cord stimulator implantation? Spinal cord stimulator implantation is a procedure where electrodes and a generator are surgically implanted under the skin to help with the management of chronic neuropathic pain. The procedure entails the implantation of tiny electrodes into the epidural space, which are then connected to a battery placed under the skin. This system generates electric impulses directed towards the spinal cord. Spinal cord stimulators are used for treating chronic pain conditions, such as nerve-related pain, complex regional pain syndrome, and failed back surgery syndrome. Benefits include a significant reduction in pain, decreased need for pain medication, and improved quality of life. Risks can include infection, bleeding, hardware malfunction, nerve damage, or increased pain. Recovery time varies, but most patients can resume normal activities within 2 to 3 weeks post-procedure. The goal is to provide long-term pain relief, reduce medication use, and improve the patient's overall functionality and quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is vertebral augmentation? Vertebral augmentation is a minimally invasive procedure to treat vertebral compression fractures by stabilizing the bone. The procedure involves injecting bone cement into the fractured vertebra through a small hole in the skin. The procedure is used to treat vertebral compression fractures, typically caused by osteoporosis or spinal tumors. Benefits include immediate pain relief, improved mobility, and prevention of further vertebral collapse. Risks can include infection, bleeding, nerve damage, or cement leaking into surrounding areas. Patients often go home the same day, with significant pain relief within 72 hours. The goal is to provide immediate pain relief, prevent further vertebral collapse, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is a discectomy? Discectomy is a surgical procedure to remove the damaged portion of a herniated disc in the spine. First, an incision is made in the back. After moving the muscles aside, the herniated portion of the disc is removed. This procedure is used to treat herniated discs causing severe low back pain, sciatica, or weakness in your extremities. Benefits include significant pain relief, improved mobility, and a quick return to normal activities. Risks can include infection, nerve damage, bleeding, or recurrence of disc herniation. Recovery time varies but typically ranges from a few weeks to a few months. The goal is to relieve symptoms, improve function, and help the patient return to normal activities. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is a discogram? A discogram is a diagnostic procedure used to determine if back pain is caused by one or more damaged or diseased discs. It involves injecting a contrast dye into a disc and utilizing imaging techniques to examine the disc's health. The procedure is used for diagnosing discogenic back pain and helping plan for potential disc surgery. The benefit of a discogram is the precise identification of pain-causing discs, which helps to guide treatment strategies. Risks can include infection, disc inflammation, or discomfort during and after the procedure. Patients typically leave the facility on the same day and rest at home for 24 hours post-procedure. The goal is to determine the source of your back pain to guide appropriate treatment strategies. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are platelet-rich plasma injections? Platelet-rich plasma injections, also called PRP, involve injecting a concentration of a patient's own platelets to accelerate the healing of injured tendons, ligaments, muscles, and joints. First, blood is drawn and centrifuged to separate the platelets. Then, the platelet-rich plasma is injected into the affected area. PRP is used to treat osteoarthritis, tendon injuries, acute sports injuries, and post-surgical repair. Benefits include accelerated healing, reduced pain, improved function, and the potential to avoid invasive surgery. Risks can include infection, nerve injuries, pain at the injection site, or tissue damage. Patients typically resume normal activities immediately, but complete healing may take weeks to months. The goal is to enhance healing, reduce pain, and improve function in the injured area. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is a selective nerve root block? A selective nerve root block is an injection of a local anesthetic and steroid to reduce inflammation and pain in a specific nerve root. A needle is guided with fluoroscopy to the nerve root. Then the medication is injected. It's used to treat radicular pain, sciatica, herniated discs, or spinal stenosis. Benefits include rapid pain relief, improved mobility, and it can serve as a diagnostic tool. Risks can include infection, bleeding, worsening pain, or allergic reactions to the medication. Post-procedure, patients can typically return to their normal activities within a day. The goal is to alleviate pain, reduce inflammation, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is a celiac plexus block? A celiac plexus block is an injection that numbs the celiac plexus nerves to help manage abdominal pain. Under imaging guidance, an anesthetic is injected to block the celiac plexus nerves. The injection is used to treat chronic abdominal pain, most often due to cancer or pancreatitis. Benefits of the procedure include effective pain control, reduced need for pain medications, and improved quality of life. Risks can include infection, bleeding, nerve damage, or allergic reactions to the medication. Patients typically resume normal activities the same day or the day after. The goal is to provide significant pain relief, improve the patient's comfort, and restore quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is minimally invasive lumbar decompression? Minimally invasive lumbar decompression, also known as MILD, is a surgical procedure to relieve pressure on one or more nerve roots in the lumbar spine. Through a small incision, specialized tools are used to remove or trim the sources of nerve compression. MILD is used to treat lumbar spinal stenosis, herniated discs, or degenerative disc disease. Benefits include significant pain relief, less tissue damage, and faster recovery. Risks can include infection, nerve damage, bleeding, or potential for further surgeries. Recovery time varies, but typically ranges from a few weeks to a few months. The goal is to relieve symptoms, improve function, and help the patient return to normal activities. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is basivertebral nerve ablation? Basivertebral nerve ablation is a minimally invasive procedure used to treat chronic low back pain originating from the basivertebral nerve. Under imaging guidance, a specialized probe is inserted to deliver radiofrequency energy to ablate the basivertebral nerve. It's primarily used to treat vertebrogenic chronic low back pain, caused by inflammation of the vertebral end plates. The benefits include significant pain relief with minimal tissue damage and represents a minimally invasive alternative to surgery. Risks can include infection, bleeding, nerve damage, or temporary increase in pain. Patients typically return to normal activities within a week after the procedure. The goal is to provide long-term pain relief and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are trigger point injections? Trigger point injections involve injecting medication directly into trigger points, which are knots that form when muscles do not relax. A small needle is used to inject a local anesthetic, saline, or corticosteroid into the trigger point. These injections are used to treat muscle groups in the arms, legs, lower back, and neck, as well as conditions like fibromyalgia and tension headaches. Benefits include immediate relief of pain, improved mobility, and relaxation of muscle knots. Risks can include infection, bleeding at the injection site, or potential for muscle damage. Patients typically resume normal activities immediately, but muscle soreness may persist for 1 to 2 days. The goal is to alleviate muscle pain, improve mobility, and enhance the patient's overall functionality. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is transcutaneous electrical nerve stimulation? Transcutaneous electrical nerve stimulation, also called TENS, is a non-invasive therapy involving the use of a low-voltage electrical current for pain relief. Small adhesive pads called electrodes deliver mild electrical impulses to the nerves through the skin. TENS is used for various types of pain conditions, including arthritis, back pain, fibromyalgia, and nerve-related pain. The benefits of this non-invasive treatment include pain relief, improved function, and reduced need for pain medications. Risks are minimal, but may include skin irritation under the electrodes. After a TENS therapy session, patients can resume normal daily activities immediately. The goal is to reduce pain, improve function, and enhance the patient's overall quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is regenerative medicine? Regenerative medicine is a medical field that creates ways to regenerate, repair, or replace damaged or diseased cells, organs, or tissues. It includes procedures like stem cell therapy, platelet-rich plasma injections, and tissue engineering. Regenerative medicine treats a range of conditions, including arthritis, spinal cord injuries, heart disease, and degenerative nerve diseases. Benefits include the potential to heal previously irreparable tissues or organs, reducing pain and improving function. Risks can include infection, allergic reaction, and the potential that the treatment may not work for your condition. Recovery time varies widely depending on the specific procedure and the individual's overall health. Overall, the goal of regenerative medicine is to restore function and quality of life by healing the body from within. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is vertebroplasty? Vertebroplasty is a minimally invasive procedure that stabilizes compression fractures in the spine. During the procedure, a special cement mixture is injected through a hollow needle into the fractured vertebra. It is primarily used to treat osteoporotic spinal compression fractures. Benefits include significant pain relief, improved mobility, and prevention of further vertebral collapse. Risks can include infection, bleeding, increased back pain, or cement leaking into surrounding areas. Most patients can return home the same day, but full recovery usually takes around 6 weeks. The goal is to provide pain relief, restore mobility, and improve quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is kyphoplasty? Kyphoplasty is a minimally invasive procedure used to treat a spinal compression fracture. During the procedure, a balloon is inserted into the fractured vertebra and inflated to create space. That space is then filled with bone cement. It is primarily used to treat osteoporotic spinal compression fractures. Benefits include pain relief, restoring vertebral height, and correcting spinal positioning. Risks can include infection, bleeding, increased back pain, or cement leakage into surrounding areas. Most patients can return home the same day, with full recovery around 6 weeks. The goal is to alleviate pain, restore spinal alignment, and improve the patient's quality of life. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is a spinal cord stimulation trial? A spinal cord stimulation trial, also called SCS, is a temporary procedure that uses electrical impulses to relieve chronic pain in the spinal cord. During the procedure, temporary electrodes are inserted into the epidural space and connected to an external trial stimulator. The goal is to determine if a permanent device will be effective for your pain. SCS is used for conditions like complex regional pain syndrome, neuropathy, and chronic back or leg pain. The trial provides a test period, typically lasting a week, to evaluate how SCS impacts your pain. After a week, the temporary electrodes are removed. Risks may include infection, bleeding, headache, or undesired changes in stimulation while using the device. Recovery time is minimal, with most patients returning to normal activities shortly after the procedure. The goal is to determine if permanent spinal cord stimulation implantation will be an effective long-term solution for your pain. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What are facet joint injections? Facet joint injections are a minimally invasive treatment to relieve back or neck pain. A local anesthetic and/or steroid medication is injected into the facet joint under imaging guidance. These injections are used for chronic pain conditions like arthritis or injuries in the facet joints of the spine. Benefits of these injections include pain relief, reduced inflammation, and improved mobility. Risks can include infection, bleeding, allergic reaction, or increased pain. Patients typically return home the same day, with full recovery a few days after the procedure. The goal is to provide pain relief and identify the source of the patient's pain to help inform future treatment decisions like radiofrequency ablation. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health. What is medical cannabis? Medical cannabis refers to using the marijuana plant or its extracts for treating certain health conditions. It is administered through various methods such as inhalation, oral ingestion, topical application, or under the tongue. Medical cannabis is used for treating chronic pain, cancer pain, nausea, epilepsy, multiple sclerosis, and certain mental health conditions. Benefits include pain relief, reduced inflammation, control of nausea, and relief from certain neurological symptoms. Risks can include dizziness, impaired memory, addiction, and potential psychiatric effects. The effects of medical cannabis vary based on dosage and the administration method, so it is advised to create a treatment plan with your healthcare provider. The goal is to alleviate symptoms, improve quality of life, and potentially reduce dependency on other medications. Thanks for watching. Please take a look at another video so you and I can have the most productive conversation about your health.